I'm Patrick Daly and I'm one of the team at the Rural Doctors Association of Australia. Welcome to our latest podcast series featuring RDAA's award recipients for 2025. In today's podcast, I'm chatting with Dr. Cheryl McIntyre, the very deserving recipient of RDAA's Rural Doctor of the Year Award, an award supported again in 2025 by the Rural Doctors Foundation. Cheryl has served the people of Inverell and region as a Rural Generalist Obstetrician for more than 25 years. With a deep commitment to medical education, she's a senior lecturer in general practice at the University of New England and plays a pivotal role in training and supervising medical students, junior doctors and GP registrars at her practice and the local hospital. This has included being one of the key drivers behind an innovative program bringing medical students to Inverell and nearby towns for 6-month placements, as well as being a strong local facilitator of a New South Wales Rural Doctors Network program bringing city-based medical students to rural locations to enable them to experience rural practice. And if she hadn't chosen a career in rural medicine, Cheryl may have become well, I'll let you find out as you listen to the podcast. Before we begin, I'd like to acknowledge the traditional owners of the land we meet on across Australia as we listen to this podcast. I'd also like to pay my respects to elders past, present and emerging, and welcome any Aboriginal and Torres Strait Islander listeners who may be joining us. Cheryl, congratulations on receiving the RDAA Rural Doctor of the Year Award for 2025. Tell me a little bit about your childhood. Were you raised in a rural area?
No, so I was a little bit of an outlier actually. So I grew up in Wollongong,
right,
which was not very rural at all. But my husband's from a rural area, and I'd always wanted to go rural. Andrew came from Inverell, and Inverell is where we came and stayed.
So what got you interested in becoming a doctor in the first place? Were you ever going to have another career?
Probably from about mid-high school. That's when I sort of decided that medicine was where I wanted to go, involving people, trying to figure out problems. That sounded like an interesting thing, not knowing very much about it actually at that stage though. But yeah, I think it was a good fit and I'm glad that I chose that path. And my backup was going to be running a coffee shop.
Oh, right. That sounds good. That sounds nice too. You mentioned that rural was on your radar from a very early stage. What drove that interest in rural? Did you have some exposure to rural outside Wollongong?
Yeah, so we'd travelled around Australia quite a bit and so seen quite a lot of some rural areas. My dad was from a rural background himself. And just seeing some of the smaller towns and places that he grew up and actually seeing some other areas in Australia, rural and remote. I always loved it.
So was it quite coincidental that you met Andrew and he had a pathway to rural for you?
Yes, that's right. Yes. So he directed where we went rural.
Right. Yes, that's right. So how many years have you been in Inverell?
Bit over 25 years now.
Right. Yeah. And you've been involved in the practice from that time?
Yes.
From the very start?
I came here as a registrar and stayed, as did the other two partners in our practice. They both came as registrars and stayed. Yeah.
So was there any other area of medicine you would have followed had you not met Andrew, do you think? Would you have ended up in any other location or any other aspect of medicine?
I think I still wanted to do rural general practice. That was always the goal. But it did help us to at least know a place to go to.
Or to open a coffee shop.
Yeah, that's right. Thankfully, there's several of those up here, so I don't need to do that.
You don't need to do that now? So what have been some of the highs and some of the challenges of being a rural doctor over the years for you?
Yeah, look, there's been lots of highs. Doing obstetrics, I think it's just been an amazing time being there at a really in-depth sort of personal time of people's lives, introducing a new family member into the world. So there's been a lot of highs, particularly in that area, but also just getting to know people over a long period of time. and, understanding things that they like, don't like, helping them to face challenges in their own lives and in their health. It's been very rewarding. But also the same things that make it rewarding make it difficult when things don't go smoothly, when things are really difficult, when people are facing difficult diagnoses and, extreme challenges in their life. That also can be one of the downs.
Has it become easier to deal with those sort of situations over the years? Have you come up with new strategies to be able to deal with them personally?
I don't know that I've got.
Or is it always hard?
Yeah, I don't know that I've got new strategies, and perhaps I've got more knowledge of, having known people for longer. It's probably
Yes.
harder. Then when you don't know people very well, it's easier to push things to the back of your mind and keep on going. But I certainly have enjoyed time away from work, time with family, and I think God's used those things to help get through the difficult patches, and there certainly have been some of those.
I'm sure one of your highlights has been teaching and training medical students and young doctors, and we'll get to a little bit about your involvement with that in a moment. But what have you learnt from your teaching roles? What have medical students and junior doctors taught you at the same time you've been teaching them, and what have been some of the highlights of that role for you?
Yep. So certainly over time, the way that we teach has changed quite a lot. I think that having multiple students or learners all together at once has been really helpful. So having people at student level, registrar level, and ourselves in there, because you do learn together. People throw up curly questions, challenges, difficult scenarios that they've faced, and you really do learn a lot together. And I think having those group teaching sessions I've found really valuable, just to see what questions other people are asking and see what angles they're coming at it from.
How has that changed over the years?
Years ago, we didn't have any rural medical students up here, really, because we didn't have a university nearby. So I don't think Inverell was on the radar for medical students. So that has made a big change. And also seeing the students at different levels of their training. So sometimes we have very early trainees through the RDN cadetships and outreach clinics. We also get to see them at year 3. Sometimes they come out for a couple of weeks at that stage. And the year 5, which is now morphed into the LIC or longitudinal integrated clerkships, where they come for 6 months at a time. That's sort of being able to see the progression of the students and see them learning and almost ready to fledge as junior doctors themselves. So that's been exciting, and it inspires you to think there are future rural doctors coming along.
Absolutely.
The last generation.
Tell me a little bit about the LIC, because you've been involved in that as a senior lecturer in general practice at the Uni of New England, which is not far from you. Mm-hmm. And you've been heavily involved in the LIC longitudinal integrated clerkship program at the university. How is it helping to deliver the next generation of doctors to the bush, and is it having a big impact?
Yeah, so I think the LIC, which Associate Professor Marie Puxty started up, really has, because quite a number of those have gone on to work as interns, residents in rural areas, much more than just the general cohort of students that we've been seeing come through the universities. I guess that's because they have chosen to do rural for 6 months. So obviously they've got an interest in rural. Quite a few of them are from rural backgrounds themselves, and that's also sparked an interest in that area for them. So we've had several years worth of students. We were the pilot site, I guess, back when the program started. And again, it's been really interesting seeing how the students have rounded off their skills, and sort of the clerkship really is to try and help them round off their skills so that they'll be proficient interns in years to come, but also given them a look at rural general practice. And now that the hospital has also come on board, so Hunter New England Health has allowed us to take those students into the hospital as well as working at the practice. I think that's broadened it even more, because they're gaining more skills in the ED. They can come with us to join in obstetrics. They can come and assist in theatre. They can do clerking on the ward. So I think it's sort of even broadened that off more.
In terms of the breakdown of rural versus metro students who embark on the program, are there metro students that elect to be part of the program and really take an interest in rural from being part of the program?
Yep. Yeah, there have been some that have come from metro backgrounds, and the program's also expanding now because there's more interest developing. So it's now also out at Narrabri. So it's been running for a couple of years out there. Our daughter actually did one of the Narrabri stints, and it's also now reaching out to Maureen, I believe, Singleton. So taking on more and more of those students that have an interest in rural medicine.
And is it starting to actually have an impact on the ground in terms of junior doctors to return to these communities to continue their medical career?
Yeah, so most of the LIC students have taken on intern and resident jobs in rural areas. Obviously, it's only been running for a few years, so the first cohort that we had are not yet into GP training yet, but they're still in that sort of intern resident years. But some of them have expressed an interest, and particularly one of our first students is expressing an interest in coming back to Inverell and doing rural GP obstetrics. So that's very heartening too.
In terms of obstetrics, is there still a lot of interest in that area as a field of medicine for rural potential or for future rural doctors? And are there other non-procedural areas that you're seeing of significant interest over the procedural areas?
So out of the LIC students, several of them did express an interest in GP obstetrics. I think GP anaesthetics seems to be a little bit more popular with the registrars at the moment, though. So they're obviously the next level on. They're already started up their GP training. So we've got a couple of registrars, one who's just left to do her anaesthetics before she comes back to us, and one who's currently at the practice who also wants to do anaesthetic training. So GP anaesthetics seems more popular with the registrars, but GP obstetrics was popular with the students.
Yes, right.
They've got a few years to go, I guess, before they solidify their decisions.
Well, they have to decide. Mm. And what about non-procedural areas? Are there areas in the non-procedural fields that are standing out more than others in terms of interest for junior doctors and medical students?
Well, we've got one at the moment who's quite the LIC student who's quite keen on GP pediatrics, but that's the only one that I can think of at the moment. Yeah, I think procedural, and the other is GP ED. So again, we've had some registrars with an interest in GP ED. So mainly seems to be that the procedural stuff is, quite enticing as well, which is great because it's necessary.
Yes, absolutely. That's right. You've also been involved in the New South Wales Rural Doctors Network's outreach student placement program. Tell me a little bit about that program, and is that having a benefit on the ground in Inverell as well?
Yeah, so I don't think we've seen it have an impact on the ground just yet because it's only been running for a few years, and they were quite early in their student training. So some of them were year 1s, 2s and 3s. Some of them were later years, but quite a few of them were for those early years. So they've still got a few years to finish their degrees and do intern years and whatnot. So we haven't seen an impact on the ground, but it was really interesting because quite a lot of those students were metro, and a lot of them were just amazed at what's going on out here. And over and over again, because they'd come and do antenatal clinics and come up to the hospital for obstetric cases with us. And they were just like, we had no idea this was going on. And I think increasing exposure at that early training stage is going to be important. Yeah, I don't know that we've got stats on it yet, but I think it is important in just showing people what's out there. How can you choose to go and do something that you don't even know exists? Yeah.
No, it's interesting. So that seems to infer that through the universities, that messaging is not getting through at the moment as to the breadth of sort of experiences you can have as a rural doctor or working in rural medicine?
Yeah, well, through the RDN outreach, most of them were metro universities and students from metro backgrounds. So I guess they hadn't been exposed to it. Whereas if they'd been at UNE, they would have probably had more rural exposure.
Yeah. Yes, absolutely. What sort of things surprise them most about what you can do in rural medicine in a rural area? What stood out to you as being the most surprising elements of what they were saying?
Well, I don't think they realised that GPs worked across practices and the hospital, and that the GPs were the people doing the procedures. I think they've only been often exposed to hospitals where there are specialists and intensive cares and all that sort of backup, I guess. And it would be run in that type of scenario rather than where there aren't any specialists at all. The backup is a long way away where all those specialty centres are, and that people are delivering babies and having cesareans and being looked after in EDs, having anaesthetics, and it's pretty much all been run by rural GPs.
Because it's a very different model in the city, and if that's what you're used to and that's what you're experiencing, it's an eye-opener.
Yep, absolutely, yeah. And pretty much almost all of them just said, wow, I had no idea that this was a career option.
Yeah, interesting. How many months did they spend, or how many weeks did they spend with you as part of that placement?
So most of them were very short term, just a couple of days for some antenatal clinics. Some of them were a little bit longer with RDN cadetships. Yeah. So a couple of weeks. Yeah. But much shorter than the LIC where they do the prolonged 6 month sort of exposure.
But for that initial exposure and experience, do you think a couple of days to a few weeks is perhaps quite a positive contribution to their decision making in terms of a future health career, future medical career?
I'd like to think so. I'd like to think so. We'll have to wait and see on that though.
Absolutely. You've probably answered this a little bit already, but what do you think needs to be done to make it easier to attract medical students, junior doctors, and registrars into general practice, and by extension, rural general practice? How can we make that pathway a little bit easier?
Well, I think they need to actually see where we are, for one, because it's hard to uproot your life if your life is connected to a particular place, Sydney, Melbourne, Brisbane, and then just go somewhere random that you haven't heard of before, unless there's a really strong reason to do so. So I think exposure and actually showing people what's possible. I know there are some programs at the moment trying to do road trips and whatnot and take some of the students out to some of the rural areas and show them what's going on out in the bush, which I think is very positive because if you don't know about it, you're not going to choose it, you're not going to want to uproot your life to do that. But I think the more we can show them and the earlier on we can show them before they've already solidified what type of area they want to specialize in, then I think it's going to be a positive.
Do you think we're making it easy enough for medical students and junior doctors to be able to sample rural practice, or do we need to be doing much more in that regard?
I think we can do more. I think, getting along some of those ideas of taking them out to the bush, showing them some places, anyone that's showing an interest, trying to give them a 1 week, 2 weeks, however long they want to term in rural medicine, I think would be really beneficial because for most people who haven't seen it before, they are astounded at what's actually going on, and the ways that you can use your skills to really impact people's lives. And also if the terms were a little bit longer, they, like the LIC, they do get to see the same patients over and over and get an idea of that sort of continuity of care that you can get when you're in a rural area, because you do see people across different scenarios and in different settings. Yeah.
Do you think showing that continuity of care is a really important and appealing factor to students and junior doctors when they're considering rural practice, to be able to see that that is what you provide and that's the contribution you make to a patient's health across the continuum?
Again, the RDN cadets probably haven't commented on it quite as much because they only get to see such a short-term look at things. But certainly LIC and some of the longer, several week student placements, they all comment on, wow, these you see these people over and again, and they've happened to go and see them in ED, and then they've seen them back at the practice, and they themselves are actually starting to link the pieces together and see that they're actually sometimes the linchpin, because they've actually seen the patient when they've gone to radiology, or seen the person up in the hospital as an inpatient, and then seen them again at the practice. So yeah, I think the longer the exposure, the more they're going to realise that. But even with the short-term students, I think they do pick up on it, because some of them will comment, you seem to already know everybody already, which we do, because of course you do. So almost all of the patients that you're seeing, you've seen before. And so you don't have to start from scratch every time, because you already know how things have gone previously, where we're up to. Yeah.
And it's quite a powerful message to be sending medical students and junior doctors of that role that you play in the community.
Yes, yeah, and I hope that it does help them to make a choice to go rural, rather than just be interested and put it on the shelf.
Yes, that's right.
But time will tell.
So outside your day-to-day work, you also continue to be an active advocate for improved access to rural healthcare. And as part of the Inverell Health Forum, you recently provided evidence to the New South Wales Parliament's Rural Health Inquiry. I'm interested to know a little bit about what you learnt from the political process in being part of this and being part of the forum, and also how best we can convince governments to do more to better deliver access, or deliver better access to care for those living in country communities. Did you get a bit of an inkling as to what works and what doesn't?
So it was very interesting listening to the other submissions to hear what their issues were. And certainly some of them were further down the road with working together with other organisations. So private practice, the hospitals, the Shire councils, and things like that. And our Inverell Health Forum was only just started at that point, but it really has grown. And I've seen a lot of benefit from connecting people together who each play a role in healthcare in different ways. So currently at the Inverell Health Forum, we've got quite a few different groups, training parties, so RACGP, ACRM, the university, as well as local council, obviously state government, because our local health district is involved. And it's really sort of trying to tie everybody together and try and move together in a direction that's going to help improve, I think, training in our area, and that will then hopefully flow on to access to healthcare in our area, because there are lots of people that want to come rural. We've had quite a few that want to come to Inverell in particular, but they can't stay here and train here and do all of their training. They have to go away, like our registrar, who's had to go back down to Maitland to do a year's of anaesthetic training. It'd be really good to be able to do more of that training in a more rural area, closer to the place that you want to go, because people that are coming out and having young families, they want to actually settle down, set roots, and stay in a place, not have to continue to shift around and move about. And we always run the risk when they have to go away to train further that we're going to lose them, and they're not going to come back, because it's very easy to go down there, meet your life partner and set roots somewhere else, and not make it back to the place that you've come from. So I hope that if we can get more training to be able to happen more locally, that will really help to improve things into the future.
Is that a message that politicians and policymakers are taking on board from your experience with the Rural Health Inquiry? Is it a message that they understand, and what steps need to be taken to make it a step that governments are happy to get behind and push further?
Yeah, so I don't think that it was very well understood. That's why they were having a commission, because we're having a health crisis with not enough workers.
Yes.
So clearly there is an issue. But the fact that they actually ran the special commission and wanted to find out what's going on, what's working well, what's working poorly, what can we do to make it different. And also, I think our area health has really shown a big interest themselves in turning things around up here, which has been very heartening. So Hunter New England Health has been joining in the Inverell Health Forum and actually been really working hard to look at trying to improve the ability to train closer to home up here. So they're looking to put on more specialists in Armidale. They're looking to see if we can actually put on doctors at our hospital who can actually have a training role as well, so that we can have junior medical staff employed and actually teach the students more whilst in hospital. So, look, I think things are changing, which is really encouraging, because for a while there, it did seem like we were going to be the last ones to turn the lights out.
Yes, which is quite worrying.
A very worrying situation, because who's going to look after us?
Absolutely. So, looking ahead now, do you actually see? Is it a feeling of positivity in regards to rural health workforce? Are you on the ground in Inverell? Are you feeling positive about the future, not just for Inverell, but for rural health in general?
Yeah, well, certainly from Inverell's point of view, I think we have got a lot of positives going on. People that have come to the area, some more registrars who want to come to the area, and a few other doctors in training also who've indicated an interest in coming up to this area. Again, time will tell whether they do or they don't, and whether we are able to train them in the ways that they want to be trained and in the areas that they want to be trained. And I'm really hoping that it will have a knock-on effect for the other small towns around us as well, because there are other towns that are doing it harder than we've been doing it, because they've got even less, or they're further away from the hubs where all the care happens. I know Inverell, we're quite a long way, obviously, from John Hunter, and all of the towns around our area are sort of the most far-flung, distant spots from the central training. So I really hope it has a good knock-on effect for them as well. And I think opening up the LIC to some of the other small towns like Narrabri, Moree, up this area, will again be positive with giving students exposure to rural medicine. And hopefully, if we can really support them well and train them well, then it'll be a positive for them too, so they'll want to work in these areas. We don't want to have them come up here and not have the training organised, worked out, supporting them, so that they feel that it's positive and they're not just sort of left to their own devices in a frightening or dangerous kind of way. So we really need to support them well.
Do you think the Rural Health Inquiry, in terms of outcomes, has really shown government that more needs to be done to look forward in terms of 10, 20 years down the track, rather than in the electoral cycle, which has always been a challenge?
Yes, and I do think so. I think that's where some of the changes that we're now seeing up this way have actually originated, because we really didn't have a lot of support from Hunter New England early on in the piece, but that does seem to be turning around now, which is wonderful to see. And I'm really hopeful for the future that, training our own up here will be the way forward, and also helping to have a pathway right from high school students all the way through that training to rural doctors in rural areas, rather than losing a lot of those young, great minds to metro and then not being able to get them back again because they've settled elsewhere.
So outside medicine, what do you do to relax? And I know I'm talking to you, I think, on the single day between being on a road trip and going on your next road trip. So I think I know the answer to this.
Yes. So traveling around in the bush, bushwalking, birding. They're the things that my husband and I really find relaxing. Yeah, getting out in nature and just enjoying the beautiful country that we have here.
And you're about to embark on another road trip, which by the time people listen to this podcast, you will have undertaken, but you're heading off to remote Queensland, I think, next.
That's right, yep. Out towards Birdsville and around that area. Yeah, so really looking forward to that.
Fantastic. Well, safe travels, Cheryl. Been great speaking with you today, and congratulations once again on receiving your award.
Thank you so much. Rural medicine is a team sport. It's not an individual thing. You can't do it in isolation by yourself. You can only go so far that way. It's really, a team. So the practice has been super supportive. My husband helps with practice management, and the other doctors that I'm working with are fantastic. You wouldn't be able to do it just on your own. We've got a great crew and great nurses, great staff down at the surgery, and great staff at the hospital as well, which, makes it even more enjoyable and makes it possible.
Absolutely, provides that support that everybody needs.
Absolutely. Yep, you can't do it by yourself.
Not even when you're operating a coffee shop, I don't think.
No, probably not.
Well, it's been great talking to you, Cheryl, and thanks again.
Thanks so much.
And that was Dr. Cheryl McIntyre, RDAA's Rural Doctor of the Year for 2025. I hope you've enjoyed this podcast, and I look forward to having you tune in again. Until next time, happy days.